You're watching Fox 9 Morning News.
And if you have a problem snoring, we have some tips and information about a procedure some people swear by. But first, let's switch gears a bit. There's some health issues that are just annoying but can be dangerous as well, like snoring. It's something an estimated 30 to 50% of us do. People try all sorts of things to stop themselves from doing it or their partner. And apparently, laser light therapy is gaining more popularity, but it's not the only way to treat it. Joining us with more about this is Dr. Kevin Bril with O'Brien Dental Care in Shakopee. Thank you so much for joining us, getting up early on a Sunday morning. First of all, let's describe what causes snoring.
Well, snoring is your body actually struggling to get oxygen into your lungs, okay? The main cause of this is usually where your tongue or your soft palate will fall into the back of your throat, primarily obstructing your airway, causing a resistance when you breathe, okay? Typically, it's minor compared to what something would be like for sleep apnea.
Okay, and describe what is that difference between your casual snorer and sleep apnea.
Yeah, sleep apnea is a serious medical condition that is diagnosed by a sleep physician. It's when your airway is actually all the way closing up multiple times throughout the night while you sleep.
Yeah, and the consequences of both, especially sleep apnea, can be pretty serious.
Very serious, yes.
What are some examples?
So you can have high blood pressure, you can develop high cholesterol, strokes, diabetes, there's a laundry list of things.
Yeah. So what are some ways to treat this? Because many people might not think to talk to their dentist maybe about snoring or sleep apnea.
Very true. Not many people think that. But typically what we do as dentists would be something called oral appliance therapy. It's going to be an upper and lower custom tray, form fit to your mouth, that'll go ahead and reposition your jaw into a position that moves your tongue and soft palate out of the way of your airway.
Okay. You have an example here on the table.
I have an example right here, yes. So as these hook together here, you can kind of see that things are not going to fall back.
Oh, I see. And it goes on sort of like a retainer?
Kind of like a retainer, kind of
Okay.
like an orthodontic device there.
Okay.
Yes.
And that's maybe step one. That's the first thing you might try with a patient.
Absolutely, yes.
If that doesn't work, where do you go?
Well, there's a new therapy out there called night lays. It's from a company called Fotona. They developed this technology. It allows us as practitioners to go ahead and use this laser light therapy to gently heat the tissue at the back of the throat to get it to kind of shrink and lift.
Okay. And this is while the patient is awake?
While the patient is awake.
Okay.
This is pain-free. You're not going to feel much at all. I kind of compare it to maybe drinking a hot cup of coffee.
Oh, okay.
So not bad at all.
And does it work the first time?
Typically, it's going to be 3 separate appointments, each 21 days apart. It takes about 20 minutes to complete the procedure, but you usually notice a big difference there after the first and second procedure, yeah.
And this is an alternative to maybe a surgery or some other options as well, right?
Absolutely, yes. It's another option out there for you.
What about this big machine you have here? Where does this come into play?
This is for sleep apnea.
Okay.
So this is what they would prescribe you if you do have that condition. It can be, as you can see, a little uncomfortable to wear.
Yeah.
Okay.
Hard to roll over when you're connected to that.
Exactly. You got to sleep in one position, and it's kind of noisy. So the person that
So you hook your nose on there and put this around your head.
Absolutely.
Okay.
Yeah.
Okay. Who does that work for?
People with severe sleep apnea.
Severe.
Yep.
Okay. Going back to the laser light therapy, so it's not painful. You need 3 times to do it. Is it covered by insurance?
It is not covered by insurance at this time.
Okay. So what does it cost for something like that?
It's around $1,200 to $1,500.
Okay. So that would be somebody that's really bothered by their snoring, or maybe their partner.
Yes, you
and
got
needs
it.
to find a remedy.
Yep.
All right. It's been around for a little while. It started in Europe?
About 1.5 years now. It started over in Europe, and it's just kind of gaining traction here in the United States right now.
What are the cons? I'm told that it is not permanent. That is one of the downfalls.
It is not permanent. People may be a little more familiar with using lasers to kind of treat wrinkles or cosmetically like that. It's kind of the same concept. We're just applying it to the back of the throat there. So you do need touch-ups every 6 months to kind of maintain what you have done.
Okay. But the patients that you've performed this on, how are they reacting?
They like it. They're not complaining about anything. They're sleeping better. If you've used it in combination therapy, like with a CPAP or an oral appliance, they're noticing that the CPAP pressure is lower, and oral appliance therapy, they're sleeping much better.
All right. If people want to find out more or are curious about this, where can they go?
You can go to the website www.fotona.com or nightlays.com to find more information.
All right.
Okay.
Dr. Brill, thank you so much. We appreciate it. Good advice. Mace, let's get it over to you for a check of the weather. We're up early. We're talking about snoring. We know how important sleep is. But look at this beautiful day ahead of us. It's time to get out there and enjoy it.
It is gorgeous. I can see why you'd want to stay in the sheets a little longer this morning, but